Ladies and gentlemen, thank you for inviting me here to speak to you today. My name is Niall Kennedy, and I'm here to share with you my experiences as somebody with chronic kidney disease on dialysis and awaiting a transplant. Originally from County Roscommon, I now live in Wexford with my wife Helen and my 3 teenage boys, Des, Owen and Cathal. I've been working as a nurse for over 30 years and currently work as a respiratory clinical nurse specialist looking after patients with chronic illnesses such as COPD, asthma, pulmonary fibrosis and sleep apnea. In preparing for this talk, I did consider the duality that is there at the heart of being somebody looking after people with chronic illness while having a chronic illness myself. But that's probably a talk for a different day. My kidney story began back in 2005 when, attending for a routine medical exam, I was found to have extremely high blood pressure. My sister had previously been diagnosed with polycystic kidney disease, so that was the first obvious port of call to investigate. And sure enough, a kidney ultrasound was performed which confirmed the diagnosis. I didn't know it at the time, but polycystic kidney disease is the most common inheritable kidney condition in Ireland that leads to, most often, kidney failure. At that stage, my kidney function was close to normal, but it was expected to deteriorate slowly over the next few years. I did my best to manage my illness through monitoring my blood pressure, my diet, under the great care of Professor Catherine Wall in Tala. But unfortunately, as there is no effective treatment for polycystic kidney disease, my kidney function continued to deteriorate, such that by 2019, I was having conversations with my kidney team regarding transplantation and dialysis. I was referred to the Beaumont Hospital transplant team, and in the following January in 2020, I was accepted onto the list. In February 2020, I commenced on dialysis. In my own particular case, I started on peritoneal dialysis. This is a home-based treatment, which I find is very suitable for my lifestyle and my family. It's a gentler form of dialysis, but it does mean that I need to do it every night for at least 9 hours a night. It's now been over 3 years since I started dialysis. It hasn't been without its ups and downs. I've been in hospital twice with infections in my dialysis tube and had to switch over to hemodialysis for 6 months, attending the hospital 3 days a week. Thankfully, I was able to revert back to PD and now continue with it for as long as it takes. I try to live my life as best I can as a husband, father, son, as a nurse, as someone who is living with chronic illness. I'm more tired than I used to be, and my life is very restricted and medically managed. I try to live my life not as a kidney patient, but as someone who is living with chronic illness. But it's never far away, and every night that I connect up to the device, the dialysis machine, I become that patient again. But being on the transplant list is a daunting position for me and my family. But I know this is nothing compared to the anguish that donor families go through. With my years of experience, and particularly working in the intensive care unit, I know the heartbreaking decisions that families make to donate their loved ones' organs. But I also know how the life-changing gift of a kidney could transform my life and that of my family. We try to live as normal a life as we can with 3 teenagers, especially playing sports and doing leaving certs and junior cert exams, preparing for college. However, my kidney condition is never far away. And my phone is constantly charged, my bags are packed, and we know that whatever we're doing as a family could change in an instant with one phone call. To me, a kidney transplant would mean freedom and hope. Freedom from dialysis every night and freedom from a highly restrictive diet. Hope for a long and healthy life and hope to see my boys grow up. Freedom and to live and to grow, and hope to live out the rest of my life with my wife Helen, who has been my rock. Thank you.